The sound of Robert Martinez's body hitting the kitchen floor wasn't much different from the noise his knees made when he played hide-and-seek with Amy. But this time, his 4-year-old daughter knew something was wrong. Very wrong. "Daddy?" Amy called out, her small voice echoing through the kitchen of the modest apartment in Aurora, Colorado. The silence that followed was deafening. Her small fingers clutched the battered teddy bear as she watched her father lying motionless on the linoleum floor. Robert Martinez was a man of routine. He woke up at 5:30 every day, made breakfast for Amy, packed her lunchbox with sandwiches cut into star shapes, and dropped her off at daycare before driving to Precision Manufacturing Solutions, where he had worked as a production supervisor for 15 years. That Tuesday morning, however, Robert woke up differently. His vision was blurred, his hands were shaking, and an unquenchable thirst consumed him. Still, he tried to remain normal for his daughter's sake. Amy was all he had left since Maria, his wife, had died in a car accident 2 years earlier. The digital clock on the microwave read 6:47 when Amy, following the instructions her father always repeated for emergencies, dragged a chair over to the kitchen landline. Her small hands trembled as she dialed the 3 numbers she had memorized. 911. 911, what's your emergency? Jessica Moore's calm voice filled the line. My dad's asleep on the floor, Amy said, her voice breaking. He doesn't wake up when I call. Jessica Moore had 12 years' experience as an emergency operator, but calls from children always squeezed her heart in a different way. Honey, can you tell me your name? Amy Martinez. Amy, you're being very brave. Can you tell me where you live? As Amy recited the address her father had made her memorize, the paramedics were already on their way. In the emergency room, Jessica kept Amy talking, extracting crucial information between stories about her teddy bear and her father's favorite color. 10 blocks away, at the East Aurora Police Station, Detective Catherine Kate Chen was taking the call. Something in her police intuition, developed over 16 years on the force, told her there was more to the story than a simple fainting spell. Paramedics Michael Rodriguez and Samantha Cooper were the first to arrive. They found Amy sitting next to her father, still holding the phone. Robert was showing clear signs of diabetic ketoacidosis, a serious condition which, as they would later discover, could have been prevented with proper routine tests. Pressure 80/50, blood glucose 485, elevated ketone, Samantha announced, connecting Robert to the portable heart monitor. We need to stabilize him now. While the medical team worked, Detective Chen arrived at the apartment. Her experienced gaze swept the room, noticing the details. Family photos on the walls, a fridge covered in children's drawings, medical bills stacked on the kitchen table. Miss Amy, Kate knelt down to the girl. Would you mind telling me a little about your father? Between sobs and hugs to the teddy bear, Amy shared fragments that would begin to unravel something much bigger. She talked about how tired her father had always seemed lately, how he complained of headaches, and how he had asked to see a doctor several times at work. In the ambulance, on the way to Aurora Medical Center, Michael found something disturbing on Robert's cell phone. A series of emails exchanged with the HR department at Precision Manufacturing Solutions. The messages revealed a history of denied requests for medical appointments and tests, always with different bureaucratic justifications. At the hospital, while Robert was receiving intensive care, Kate Chen began to connect the dots. A preliminary search revealed that over the past 3 years, dozens of Precision Manufacturing Solutions employees had filed similar complaints about denied medical coverage. This is no coincidence, Kate muttered, watching through the ICU window as Amy, holding her teddy bear, watched the doctors care for her father. The detective picked up her phone and dialed a familiar number. Marcus, it's Kate. I need you to take a look at some records from Precision Manufacturing Solutions. Something tells me we found the tip of a much bigger iceberg than we realized. Marcus Washington, an FBI special agent specializing in corporate fraud, was about to be handed a case that would change his career. What began with a 4-year-old child calling emergency would turn into one of the largest corporate health insurance fraud investigations in Colorado history. Meanwhile, in the hospital room, Amy slept in a makeshift armchair, her teddy bear watching over her father, who was beginning to recover. On the nurse's desk, a few meters away, a pile of documents began to tell a story of corporate greed, lives at risk, and the love of a little girl who, with a simple phone call, was about to expose a scheme that affected thousands of families in 5 different states. Night was falling over Aurora, and as the city lights began to glow, a new investigation was about to begin. Kate Chen looked once more at the room where Amy rested and made a silent promise. The truth would come out, no matter how much some wanted to keep it buried. The file room at Aurora Medical Center was silent when Detective Kate Chen swiped her badge at the entrance. The digital clock read 23:45, and the only sound was the gentle hum of the air conditioning system. As she rummaged through the medical records for the last 3 years, a pile of documents began to tell a disturbing story. "This doesn't make any sense," muttered Kate, comparing the dates of test requests with the responses from the health plan. In front of her, dozens of Precision Manufacturing Solutions employees had had requests for preventive exams denied for lack of proven medical necessity. Upstairs, Robert Martinez was still under observation in the ICU. Amy slept on the sofa in the room, while the night nurse, Rachel Dawson, monitored the patient's vital signs. Rachel had 20 years' experience, and something about this case bothered her deeply. "Detective?" Rachel called out when she saw Kate passing in the corridor. "Do you have a minute?" Kate entered the nurse's station, where Rachel was fiddling with an old computer. "In the last 6 months, we've received 15 emergency cases from Precision Manufacturing, all with complications that could have been avoided with basic tests." Kate's phone vibrated. A message from FBI agent Marcus Washington. "I found something. Meet me at the coffee shop around the corner in 20 minutes. The Midnight Brew was one of the few establishments open 24 hours in Aurora. Marcus was already sitting in an inconspicuous corner when Kate arrived, a thick folder on the worn table. Precision Manufacturing Solutions is part of a larger conglomerate, Marcus began, his voice low. Vertex Healthcare Management. They manage corporate health plans in 5 different states. And let me guess, all with the same standard of negatives? Marcus slid a document across the table. Better. We found internal emails discussing a policy called Preventive Resource Optimization. Basically, an algorithm that automatically denies certain types of tests based on cost versus statistical probability of a positive diagnosis. They were gambling with people's lives, Kate concluded, feeling her stomach turn. The next morning, Robert Martinez woke up to find his daughter drawing with crayons on a clipboard. Next to her, Dr. Alexandra Foster, the hospital's endocrinologist, was reviewing her tests. "Mr. Martinez, your condition could have been easily diagnosed with a simple annual blood test," explained Dr. Foster. "Why haven't you had any preventive tests?" Robert coughed, his voice still hoarse. "I tried. For 3 years in a row. The health plan always denied it, saying there was no sufficient clinical indication." Kate watched the conversation from the doorway, making notes on her pad. Her phone rang. It was Lisa Montgomery, a former Precision employee who had responded to her request for information. "After I was fired, I tried to report the scam," Lisa explained over the phone. "But they have a very powerful legal team. Nobody wanted to listen to me." Meanwhile, at the FBI's regional office in Denver, Marcus was putting together his investigation team. Ana Rodriguez, a financial fraud specialist, and David Park, a data analyst, were examining thousands of digital records. "Look at this," Anna pointed to her screen. They didn't just deny the tests, they changed the diagnosis codes in the medical records to justify the denials. David nodded, typing furiously. And there's more. Their algorithm was programmed to prioritize denials in low-income areas, communities where people would have fewer resources for legal recourse. Back at the hospital, Amy showed her drawings to social worker Patricia Weber. Between colorful scribbles, the little girl unconsciously provided more pieces of the puzzle. Dad was always sad after calling in sick to work, Amy commented, coloring in a yellow sun. He said he needed to save money for when he got sick because the TV doctor was so expensive. Patricia exchanged meaningful glances with Kate, who was documenting every word. The case was growing beyond her initial expectations. In the afternoon of that day, Kate received an anonymous phone call. The voice on the other end belonged to James Wilson, a mid-level executive at Vertex Healthcare Management. I can't officially identify myself, he whispered, but you need to look at the records for 2019. There was a board meeting. They knew exactly what they were doing. Kate quickly organized a virtual meeting with Marcus and his team. On a split screen, they shared findings and theories. The picture that was forming was devastating. A deliberate corporate conspiracy that had put the lives of thousands of workers at risk in order to save on insurance costs. We need more, Marcus argued, something concrete that links executives directly to decisions. Maybe we already have, Kate replied, picking up her phone. She opened a photo she had taken earlier, a stack of exam denial forms, all with the same digital stamp. Reviewed and approved per protocol VHM 2847. The protocol Wilson mentioned, Marcus recognized, his eyes twinkling. If we can trace the origin of that code. The investigation was gaining momentum, but Kate couldn't get the image of Amy out of her head, sitting by her father's bed, drawing her world with crayons. How many other children had almost lost their parents because of this corporate fraud? The sun was setting over Aurora when Kate returned to the hospital for one last check. In Robert's room, Amy had fallen asleep holding her teddy bear while the nurses changed her medication. The detective looked down at her notebook, where a complex web of names, dates, and connections was beginning to take shape. The truth was emerging, one document at a time, and Kate Chen was determined to ensure that every person responsible for putting profits before lives faced the consequences of their actions. The FBI's Denver office was buzzing with activity that morning as Marcus Washington gathered his team in the conference room. The glass walls were covered with documents, photos, and diagrams connected by red lines, forming a complex web that linked precision manufacturing solutions to Vertex Healthcare Management. "We've got something big here," announced Ana Rodriguez, spreading out a new set of documents on the table. "We found a pattern in the denial algorithms. They didn't just refuse preventive exams. They directed patients to specific clinics when the condition worsened." David Park projected a series of graphs onto the screen. The clinics were part of a network called Medcare Solutions. Guess who owns it? A subsidiary of Vertex Healthcare. Kate Chen, who had just come from the hospital, sat down heavily in a chair. So they were making twice the profit, saving on preventive care and making more money in the emergency room. At Aurora Medical Center, Robert Martinez was having his first session with Dr. Nathan Harris, a diabetes specialist. Amy was playing in the children's corner of the office, apparently absorbed in her drawings, but her attentive ears didn't miss a word. "Mr. Martinez, your blood sugar levels suggest that this condition has been developing for at least 2 years, explained Dr. Harris, frowning at the test results. "With basic monitoring, we could have prevented ketoacidosis." Robert clasped his hands in his lap. "I knew something was wrong. I asked for the test several times, but I always got the same automated response. No sufficient clinical indication." Meanwhile, at the Precision Manufacturing Solutions office, Detective Chen and Agent Marcus were conducting a search authorized by a court warrant. In the digital file room, they found Jennifer Cooper, the new HR manager, visibly nervous. "I only started 6 months ago," Jennifer explained, her hands shaking as she typed passwords into the computers. But something always seemed wrong with the medical approval system. Analyst David Park connected a device to the main server and began copying terabytes of data. Within minutes, decades of records began to reveal a disturbing pattern of systematic negligence. In the next room, Ana Rodriguez was interviewing current employees. An administrative assistant, Melissa Green, wept as she recounted her own experience. "My sister worked here for 12 years. She died of breast cancer last year, a type that could have been detected in routine exams if they had approved it." The case was growing exponentially. Kate received a call from Rachel Dawson, the nurse at Aurora Medical Center. "Detective, you need to see this. We're finding similar cases in every hospital in the region. It's like a social experiment," Kate added, her stomach churning. "They've turned entire communities into test laboratories for their business model." Later that afternoon, Marcus called an emergency meeting with federal prosecutors. Prosecutor Brandon Mitchell's office was packed when Kate presented the preliminary evidence. "This isn't just health insurance fraud," Kate explained, showing a series of slides. "It's an elaborate conspiracy to maximize profits through calculated human suffering." Brandon Mitchell, a normally restrained man, let out a low curse when he saw the figures. "How many people were affected?" "By our initial calculations?" Anna consulted her notes. "More than 50,000 employees and their families spread across 5 states. At the hospital, Amy continued her silent vigil at her father's side, now accompanied by Patricia Weber, the social worker. The little girl had become a kind of mascot for the investigation team, her act of courage in calling 911 having triggered the whole case. "Do you know what impresses me the most?" Patricia commented to Kate during an evening visit. "How a 4-year-old could see what so many adults didn't, that something fundamentally wrong was going on." The investigation continued to branch out. James Wilson, the anonymous informant, finally agreed to meet Kate and Marcus in person in an underground parking lot in Denver. "You don't understand," Wilson whispered, looking nervously over his shoulder. "This goes beyond Vertex. There are other companies using the same model. It's an entire system designed to—" The sound of screeching tires interrupted the conversation. A black car sped towards them, forcing the 3 of them to duck behind a pillar. When the dust cleared, Wilson had disappeared, leaving behind only a briefcase with more compromising documents. Back at the FBI office, the team worked through the night, processing the new information. David discovered connections to other healthcare corporations, all using variations of the same denial algorithm. "It's like a virus," observed Anna, studying the patterns. They were selling the system as a cost optimization solution to other companies. Kate looked out of the office window, watching the lights of Denver flicker in the night. Somewhere out there, thousands of people slept unaware that their lives were being evaluated by cold algorithms, their medical needs reduced to cost-benefit equations. His phone vibrated. A message from Rachel Dawson. "Robert has been discharged. Amy is taking him home." The detective smiled, thinking of the little heroine who had unknowingly begun to dismantle an empire built on the suffering of others. But her smile soon faded as she realized that the battle had only just begun. Marcus entered the room with more coffee. "We need to protect our witnesses. If they try to intimidate Wilson—" "They're desperate," Kate added, "which means we're on the right track." The night wore on, and as the team continued their painstaking work, one thing became clear. The case that began with an emergency call from a child was about to expose one of the biggest corporate frauds in recent U.S. history. The sound of hurried footsteps echoed through the empty corridors of the 14th floor of the federal building in Denver. It was almost midnight when Brandon Mitchell, the federal prosecutor, called an emergency meeting with Kate Chen and Marcus Washington. The evidence uncovered in the last 48 hours had turned the case into something much bigger than any of them had imagined. "We found connections to 3 state senators," Brandon announced, spreading out documents on the conference table. "All have received substantial donations from Vertex Healthcare in the last 5 years, coincidentally after blocking legislation that would have required greater transparency in health insurance denials." Kate studied the papers, her long-forgotten coffee cooling next to her. "And that explains why Wilson was so scared. We're not just dealing with corporate executives." At Aurora Medical Center, Robert Martinez was attending his last appointment before his final discharge. Dr. Alexandra Foster was reviewing his new tests when she noticed something disturbing in the old records that had finally arrived from Precision Manufacturing. "Mr. Martinez," she called out, frowning at the computer screen, "your 2021 blood tests already indicated prediabetes. Why weren't you informed?" Robert blinked, confused. "What tests? All my requests were denied." The discovery led the investigation team to a new lead. Ana Rodriguez and David Park spent the early hours of the morning tracing a pattern of changes in the digital medical records. Not only were tests denied, results were deliberately withheld from patients. "They had a second server," David explained the next morning, his eyes red with fatigue. "All positive results were automatically redirected to a separate database, while edited versions were sent to doctors and patients." Meanwhile, Amy Martinez returned to her routine at Little Stars Nursery, where her teacher, Michelle Larson, noticed subtle changes in the little girl. During drawing time, Amy was now creating images of people in blue uniforms, the policemen and paramedics who had saved her father. "She's become more observant," Michelle commented to Patricia Weber during a follow-up visit. "Yesterday, when Tommy fell in the playground, she was the first to realize something was wrong and call for help." The investigation was gaining momentum. James Wilson, after the incident in the parking lot, had been placed under federal protection and began revealing crucial details about Vertex Healthcare's internal operations. "The algorithm wasn't just about cutting costs," he explained during a taped interview. "It was part of a feasibility study. They wanted to prove that they could implement the system nationally through a bill that is going through Congress." Kate felt her blood run cold. "What bill?" "Bill 2847, the same protocol number they used for the denials. It's no coincidence." Marcus immediately activated contacts in Washington, discovering that the bill, discreetly attached to a larger package of health reforms, would allow insurance companies to use automated risk analysis systems to determine medical coverage. At the FBI's regional office, the team set up a dedicated situation room. Photos, documents, and timelines covered the walls, connecting Vertex executives to politicians, lobbyists, and a growing network of front companies. "Look at this," Anna called out, pointing to her laptop. "Medcare Solutions isn't the only clinic network involved. There are at least 5 others, all strategically positioned in areas where Vertex operates." Rachel Dawson, the nurse who first noticed the pattern of cases at Aurora Medical Center, had begun compiling a database of affected patients. The stories were devastating. Late cancer diagnoses, avoidable heart complications, undiagnosed diabetics like Robert. "These aren't just numbers," Rachel insisted during a meeting with the investigation team. "These are real lives, families destroyed by an algorithm." The pressure was beginning to have an effect. Vertex Healthcare employees began to approach the investigators, offering information in exchange for immunity. Kate and Marcus could barely process the volume of new evidence. At home, Robert Martinez was recovering, watching his daughter play in the apartment's small garden. Amy had developed a new game, Emergency Doctor, where her teddy bear diagnosed and treated other toys. "She's going to be a great doctor one day," Patricia commented during a follow-up visit. Robert smiled, but his eyes were worried. If we can change the system, I don't want her to grow up in a world where lives are worth less than profits. Later that week, Kate received an anonymous phone call. An electronically distorted voice informed her of a Vertex Healthcare board meeting scheduled to take place at a hotel in Chicago. "They're going to try to destroy evidence," the voice warned. "Day 15, Chancellor Hotel, Magnolia Room." The investigation team went into action immediately. Warrants were issued, tactical teams deployed. The siege was closing in, but Kate couldn't stop thinking about Amy Martinez and her 911 call. How one child's brave act had begun to crumble an empire built on lies and greed. "Sometimes," Marcus commented, watching the sunset through the office window, "it takes the innocence of a child to expose the truth that adults refuse to see." Kate nodded, once again reviewing the documents on her desk. The battle was far from over, but for the first time since the case began, she could see a clear path to justice. The sun was setting over Aurora, casting long shadows over the city. Somewhere, an algorithm was still at work, denying examinations and altering records. But its days were numbered, thanks to a little 4-year-old heroine who refused to accept that her father was simply sleeping on the floor. The meeting room of the Chancellor Hotel in Chicago was silent when FBI agents burst in. Vertex Healthcare executives froze in their positions, confidential documents spread out on the mahogany table. CEO Charles Blackwell discreetly reached for his phone, but Marcus Washington was quicker. "Don't even think about it, Mr. Blackwell," Marcus warned, confiscating the device. "We have warrants for all the electronic equipment in this room." While the FBI tactical team conducted the arrests, Kate Chen supervised the collection of evidence downstairs. Boxes of documents were methodically catalogued, each page potentially crucial to the case expanding by the hour. In Aurora, Robert Martinez was testifying before a federal grand jury, his firm voice echoing through the austere room. "It wasn't just me," he explained, adjusting the knot of his borrowed tie. "I've seen coworkers die because they couldn't pay for treatments that should have been covered." Amy was in the next room with Patricia Weber, drawing another of her portraits of the heroes. This time, a figure in a suit who looked remarkably like Assistant District Attorney Sarah Kendricks, who had become a constant presence in their lives. At the FBI office in Denver, Ana Rodriguez and David Park were making disturbing discoveries on the seized servers. The algorithm wasn't just programmed to deny scans, Ana explained during a video conference with the team. It prioritized denials based on probabilities of lawsuits. The lower the chance of a family suing, the higher the chance of denial. "Fucking cynics," muttered Rachel Dawson, who was attending the meeting representing the health professionals. "They've turned poverty into profit." The investigation revealed an even more sinister network. James Wilson, now safe in a secure house outside Portland, provided access to encrypted emails that linked Vertex Healthcare to an organization called the Healthcare Optimization Initiative, a think tank that influenced healthcare policies across the country. "It was a perfect scam," Wilson explained to Kate during a recorded interview. "They would create fake studies showing how algorithmic optimization reduced costs, convince legislators to pass favorable laws, and then sell the system to other companies." At Aurora Medical Center, Dr. Alexandra Foster kept discovering cases similar to Robert's. "I have patients who developed complications. I have patients who have developed serious complications because basic tests were denied," she reported during a meeting with investigators. "It's as if we've gone back to the time before compulsory health insurance." The pressure was beginning to have an effect. 3 mid-level Vertex executives approached the public prosecutor's office offering plea bargains. Brandon Mitchell worked nights in a row preparing the agreements, each confession revealing new layers of corruption. "They had a list," revealed Jennifer Cooper, former HR manager at Precision Manufacturing, now a key witness. "They called them high-risk profiles. employees with a family history of chronic illnesses. They were the first to be denied exams. In Washington, House Bill 2847 was put on hold after senators received dossiers detailing its connection to the scheme. Senator Richard Hayes, the bill's main supporter, announced his early retirement the same afternoon. Amy Martinez, oblivious to the political ramifications her 911 call had triggered, remained an unwitting source of inspiration for the investigation team. During a visit to the FBI office with her father, she presented Kate with a drawing. Stick figures wearing badges and holding briefcases surrounding a large gray building. "It's you catching the bad men who hurt Daddy," she explained with the simplicity befitting her 4 years. Kate hung the drawing on her evidence board, a constant reminder of what was really at stake. These weren't just numbers on spreadsheets or algorithms on servers. These were real lives, families like the Martinezes, multiplied by thousands. The investigation was entering its final phase. Search warrants were executed simultaneously at Vertex healthcare offices in 12 states. Digital forensics teams were working around the clock, recovering deleted data and reconstructing audit trails. "We found something interesting," David Park announced during an evening meeting. The algorithm had an internal nickname, Project Lazarus, because they literally let people almost die before approving treatments. The cynicism of the choice of name caused a heavy silence in the room. Marcus Washington broke the moment with urgent news. Charles Blackwell had tried to flee the country, but was detained at Toronto Airport. He had a flash drive, Marcus reported, his face tired but satisfied on the video conference screen. It contains records of payments to politicians, judges, and regulators. We're talking about a decade of documented corruption. In Aurora, Robert Martinez was back at work for the first time since his hospitalization. Precision Manufacturing Solutions was under new management, following federal intervention. A new human resources department had been established, with transparent medical benefits policies. "It's strange," he commented to Kate during a break in his testimony. "This all started because my 4-year-old daughter knew something was wrong when no adult wanted to see it." Kate nodded, thinking about how sometimes it takes the innocence of a child to expose the lies that adults construct around them. On her desk, Amy's drawing served as a constant reminder that behind every statistic, every test denial, there was a human story waiting to be told. Night was falling over Denver when Kate finally left the office. On the horizon, the city lights looked different now, each potentially representing a family that had unknowingly been affected by the scheme they were dismantling, one piece at a time. The federal courthouse in Denver was packed the morning the trial against the Vertex healthcare executives began. Kate Chen watched from the gallery as Charles Blackwell and 5 other defendants took their seats, their expensive suits failing to mask the nervousness evident on their faces. Brandon Mitchell stood up to make his opening statement, his voice ringing clear and firm through the room. "Ladies and gentlemen of the jury, this case is not just about numbers on spreadsheets or codes on computers. It's about 50,000 American families who had their lives deliberately put at risk by a system designed to turn their suffering into profit." In the front row, Robert Martinez held the hand of Amy, who was hugging her inseparable teddy bear. Next to him, Rachel Dawson and Dr. Alexandra Foster represented the health professionals who had helped expose the scam. James Wilson was the first witness. His detailed testimony about Vertex's internal operations caused a stir in the courtroom. The algorithm was not a programming error or a poorly executed policy, he explained. It was a weapon, scientifically calibrated to identify and exploit the most vulnerable people in our society. During the break, Marcus Washington received an urgent call from his team in Chicago. "We found more servers," Ana Rodriguez reported. They had similar operations in development for prison systems and public schools. Vertex was just the beginning. The revelation led to a new wave of investigations. David Park spent 3 days straight analyzing the new data, discovering connections with other corporations and politicians across the country. They were creating a business model based on the systematic denial of essential services, he explained during an emergency meeting. Health was just the pilot project. Jennifer Cooper testified about how the system identified preferential targets, families who, due to their financial circumstances, would be less likely to question denials or seek legal recourse. Her voice shook as she described how she saw the faces behind the numbers she manipulated. There was a list, she revealed, tears streaming down her face. We called them priority containment profiles. These were people like Mr. Martinez, single parents, immigrants, low-income workers. The algorithm marked them in red. Assistant U.S. Attorney Caroline Reeves presented internal emails showing Vertex executives celebrating savings achieved through the program. Every dollar saved, she read to the jury, represented an exam denied, a treatment postponed, a life put at risk. In the hallway of the courthouse during another recess, Amy drew another of her portraits of the heroes. This time, the 12 members of the jury, depicted as guardians in colorful capes. Patricia Weber, observing the drawing, noticed how the girl had perfectly captured the seriousness in their faces. It's amazing, Kate commented to Marcus, how she can see the essential truth in it all. For Amy, it's simply a question of right and wrong. The defense tried to argue that the system was just a resource management tool, but their justifications rang hollow in the face of the evidence presented. The devastating testimony of affected families, including the widow of an employee who died of a heart attack after being repeatedly denied preventive exams, left the jury visibly shaken. Robert Martinez was one of the last witnesses. He described the months of ignored pain, the denied requests for tests, the constant fear of leaving Amy alone. But the worst thing, he said, his voice breaking, was discovering that my near death was not an accident. It was a calculated decision, made by people who never looked their own children in the eye and imagined leaving them orphans. The verdict came after 5 days of deliberation. Guilty on all counts, Charles Blackwell and his accomplices would face decades in prison. Vertex Healthcare would be dissolved, its assets used to create a compensation fund for the victims. But victory in court was only the beginning. Kate knew that similar systems continued to operate across the country, cold algorithms deciding who deserved to live or die based on cost-benefit spreadsheets. What do we do now? Marcus asked as they watched Amy and Robert leave the courthouse, hand in hand, followed by a procession of other affected families. We keep fighting, Kate replied, picking up her phone, which was already ringing with information about another suspicious case in Seattle. One story at a time, one life at a time. In the courthouse parking lot, Amy stopped to draw one last picture. This time it was a simple image, people holding hands in a circle around a heart. So that no one is ever alone again, she explained. Kate kept the drawing in her briefcase along with the thousands of pages of evidence that had led to the conviction. Somewhere she knew another algorithm was running. Another system was sorting human lives into columns of profit and loss. But now there was a precedent. A path to justice opened up by a 4-year-old child who refused to accept that his father was simply sleeping on the floor. The Martinez story would become a case study in law schools, an example of how the courage of a child and the dedication of a few determined individuals could bring down a corrupt system. But for Amy, playing with her teddy bear while her father drove her home, it was simply the story of how she had saved her father and, in the process, helped save many other families. The sun was setting over Denver, casting long shadows over the courthouse building. Kate Chen put her notes away, knowing that tomorrow would bring new challenges, new battles. But for today, justice had prevailed. thanks to a little heroine who had proved that sometimes the deepest truth can come from the youngest voices.